I want you to meet Doug. Doug is a 2-year-old rescue Mastiff who was adopted in Alabama and has just recently relocated to Pennsylvania with his family. He visited the veterinarian in Pennsylvania for his first routine wellness exam, and though he looked healthy, this exam visit actually revealed a couple abnormal findings that I want to go over with you right now. So, Doug's physical exam was perfectly normal, and his veterinarian did run comprehensive wellness testing in compliance with all of our evidence and expert-based guidelines. His blood chemistry was run, his CBC, urinalysis, as well as a fecal GI parasite PCR test and an Acuplex Vector-Borne disease screening test that was also run at the reference lab alongside all of these other tests. So the key screen parasite PCR panel results were all negative. He had no GI parasites, but his Acuplex revealed two abnormal findings that I want to go over with you. The first is that he tested positive for exposure to Lyme disease. So in other words, he had produced antibodies to the bacteria that causes Lyme. Fortunately, when we ran the urinalysis and we looked at his urine for protein in the urine, that came up negative. He had no clinical signs, so we were out of the woods on that end, and we just shifted our focus to ongoing prevention, compliance throughout the year, as well as ongoing monitoring of those kidneys. His heartworm test on that Acuplex test also came up positive. So a microfilaria test was run to look for those larvae that would show that there's an active heartworm infection. And in Doug's case, he actually did have those circulating microfilaria, those little larvae floating around or swimming around in his blood. So he does need to begin heartworm treatment. So this case actually underscores a couple really important points. First of all, early detection is really important, and these infections can be found in dogs that look seemingly healthy. So even healthy pets carry hidden diseases. Wellness screenings catch these problems early. And of course, in the case of these vector-borne diseases, these are also oftentimes diseases that can be transmitted to people. And so we need to always be vigilant. When we find these diseases in our pets, we need to underscore to owners that there's also potentially a public health risk because these dogs are bringing these vectors into our homes.